Hello, Assalamu alaikum. It's me, Dr. Naseem Shirzad, and today I am going to discuss with you all the paraneoplastic syndrome. And among urological malignancy, paraneoplastic syndrome is most commonly associated with renal cell carcinoma. And the patient which having paraneoplastic syndrome and RCC, that is 20%. And the major component of the paraneoplastic syndrome in RCC include anemia, blood pressure, cachexia, deranged ellipses, ESR, fever, glucose intolerance, hypercalcemia, and jaundice in the form of stupor syndrome. The most common paraneoplastic syndrome in RCC is increase in ESR followed by anemia, followed by cachexia, and followed by hypercalcemia. Now, what are the common causes of hypercalcemia? The commonest causes of hypercalcemia in RCC include PTH-like peptide secretion, tumor-derived vitamin D, prostaglandin secretion, and the osteolytic bone mets that's produced causing hypercalcemia. And now they can ask what is the normal level of serum calcium. The normal value is 9 into 10.9 to 10.5 milligram per deciliter. And which type of metastatic lesion in the bone occur in the RCC? So in RCC, the lesion which occurring, that is osteolytic, while in prostatic cancer, that is osteoblastic, means a bone forming tumor. So RCC is not a bone forming tumor, it's bone breakdown tumor. It causes the lysis of the bone, that's why it's called hypercalcemia. So it causes osteolytic tumor. What are the symptoms of increased PTH in a patient with paraneoplastic syndrome? It causes bone, stone, groan, and moans. Means it causes bone pain, it can cause stone, renal stone, it can cause abdominal groans, and it can cause psychic moans. The substances which is produced by the kidney include renin, erythropoietin, prostaglandin, and 125 vitamin D. Now they can ask why there is a fever and weight loss in paraneoplastic syndrome in RCC, and this is because of multiple reasons, including the production of increased level of insulin, cytokines, and inflammatory mediator that leading to fever and weight loss in case of paraneoplastic syndrome. And what are the signs and symptoms of hypercalcemia? How will you know that this patient is having hypercalcemia? So patient will be having anorexia, fatigue, nausea. These are the symptoms. And what are the signs? The sign decrease slow deep tendon reflex, and ECG will be showing arrhythmias and short QT interval. And how will you treat hypercalcemia in these patients? So better first hydrate the patient, then give Lasix, which is a loop diuretic to cause diuresis, followed by bisphosphonate, and then corticosteroid and calcitonin. The most common bisphosphonate which we are using, that is zoledronic acid, which is available in market and name of Zometa, and it's given 4 milligram IV in 100 ml saline, and it's given monthly once or 21 day. And the investigation which is important before giving this Zometa or zoledronic acid, which is a bisphosphonate, better to perform the RFTs of the patient, urea creatase. Zoledronic acid can cause renal impairment, and dental examination is also important, as zoledronic acid can cause osteonecrosis of the jaw. And please repeat serum calcium level before each zoledronic acid injection infusion. What are the causes of anemia? As we know that paraneoplastic syndrome can cause polycythemia and anemia. So the cause of anemia in RCC is hematuria, microcoagulopathy, bone marrow depression, because if there is bone marrow depression, there will be no RBC formation, and because of cachexia, nausea, and anorexia. So these are the causes of anemia in RCC. Now, what are the causes of hypertension in case of paraneoplastic syndrome? The cause of hypertension include increased production of renin by tumor itself, increased compression of renal artery vasculature parenchyma, so this is also leading to increased renin, AV malformation, polycythemia, and ureteric obstruction. These all leading to hypertension. Now, what are the causes of increase in ESR in RCC? We know that polycythemia is a common cause of increase in ESR. So, because of polycythemia and increased cohescence between RBC, that's leading to increased in ESR. So, this is the reason that why ESR increase in RCC. And what are the causes of polycythemia in paraneoplastic syndrome? That's the increased production of erythropoietin by the tumor, and erythropoietin released in response to hypoxia-induced growth factor. So because of these reasons, there is increased that leading to polycythemia. Now, what is Stupor syndrome? This is actually the non-metastatic hepatic dysfunction, which is known as the Stupor syndrome. What are the components of Stupor syndrome? There will be low bilirubin, low albumin, low thrombocyte, neutropenia, but there will be high albumin, high alkaline phosphatase, and high PT. So alkaline phosphatase and PT will be high, remain everything will be low, like bilirubin, albumin, thrombocyte, and neutropenia. What are the investigation to be done in order to if a patient is having deranged ellipses in presence of paraneoplastic syndrome? So liver appearance ultrasound or CT scan, rule out hepatic mets, and liver biopsy. And what is the reason behind this Stupor syndrome? This Stupor syndrome is actually caused by the cytokines interleukin 6, which is produced by the tumor. And in patient after radical nephrectomy, the ellipses return to normal in 70% of cases. And if the patient RFT is not returned to normal, means there is persistence of unresected tumor or there is a mass tumor. Now let discuss clinical presentation of the RCC. The most common presenting feature of RCC is incidental, that is found by performing ultrasound from some other region. But the classical triad, which is present in only 10% of the cases, that is plunk vein, hematuria, abdominal mass. And this triad is also called too late triad because this presentation is very late. Now, what are the indicators that can tell you that the patient is having advanced stage disease in RCC? That is weight loss, fever, night sweats, palpable mass, cervical lymph nodes, varicocele that is non-reducible, and fetal edema. When you will get right-sided varicocele, the patient will be having right-sided varicocele, and the reason is that there will be abnormal drainage of right gonadal vein into right renal vein, blunt thrombus at the ostium of gonadal vein, rarely tumor thrombus is the ostium of gonadal vein, and IBC thrombus. So the reason behind this right-sided varicocele may be abnormal drainage of right gonadal vein into the right renal vein. There may be a blunt thrombus at the ostium of gonadal vein, really tumor thrombus at the ostium of gonadal vein, and IBC thrombus. Why is there hematuria in RCC? The infiltration of the pelvic ileal system by RCC, this is the reason. Increased new vascularity, there is a renal congestion, there is obstruction of venous outflow, and AV malformation. So these are the reasons that causing hematuria in RCC. What are the causes of pain in contralateral side of the kidney? There are two reasons that the patient will be also complaining of pain on contralateral side. This is because of the compensatory hypertrophy and capsule expansion, and the second is due to sympathetic nephritis. Now, how we will differentiate there is a glomerular hematuria or renal hematuria? We will see the RBC shapes and cast. So this is important. What is the importance of vermiform clots? The importance of vermiform clots means that the bleeding is from upper tract.